The fundamental concept of an effect size has been around since at least 1940. What is being called an effect size in education now is most similar to Cohen's d. Cohen's d was introduced in the late 1960s by Jacob Cohen, a statistician in psychology. There are many kinds of effect size, but in this video I will only refer to Cohen's d. Cohen's d is sometimes called a standardized mean difference. The concept is based on having an experimental design in which there is a control group and an experimental group. The control group is a group of students that does not receive an intervention. The experimental group, on the other hand, does receive an intervention. Ideally, people are assigned randomly to the two groups. Also, ideally, a study will include a pre-test prior to a program or intervention and a post-test after the intervention. Having said this, many studies just use random assignment, and the results of two groups on a single test are compared. In this case, the assumption is made that the average abilities would have been the same if there had not been an intervention for either group. So why calculate an effect size? Firstly, it's useful to consider the aim of an experimental design. The aim of an experimental design is to ascertain how much effect an intervention has on something like reading ability. Here, you can see the distributions of test scores for a control group and an experimental group separately. Now, in this next figure, the distributions are the same, and there is no indication that the intervention had an effect. As the averages of the groups get farther apart, the effect size is said to increase. Here we can see what the distributions look like, starting at an effect size of 0 and moving through to an effect size of 1. Now let's look at how effect size is calculated. First, the difference between the averages of the two groups is calculated. Second, the standard deviation of the groups is calculated. This provides an index of the spread of scores in the groups. Third, to calculate the effect size, the average difference is divided by the standard deviation. Here is the equation for calculating effect size. The point of this effect size is to express the average difference of students' test scores in terms of the standard deviation. This is useful for interpreting results. For example, if the students' scores are normally distributed, an effect size of 0.4 means that 66% of students in the experimental group are above the average for the control group. An effect size of 1 means that 84% of students in the experimental group are above the average for the control group. Computing effect sizes is also useful for comparing the results of different studies, a method that's called meta-analysis. Although effect sizes can be helpful, there are some considerations to bear in mind. I'll cover these next. The trouble is, without an experimental design, there will never be definitive evidence that a change in student scores is the effect of a specific cause, such as teaching. This means that a change in student scores on a test cannot be regarded as the effect of any specific cause. The reason that a change in scores cannot be attributed to a specific cause is that many factors influence students' progress. Some examples are student potential, motivation, peer interactions, the broader school environment, parental engagement, private tutoring, resources, and so forth. When we use the term effect size, we need to ask what causes the effect. In an experimental design, the aim is to control all factors other than the one whose effect we wish to establish. For example, if we wish to identify the effect of the teacher, ideally we will control all factors that are not under the direct control of the teacher. Selecting students randomly into groups makes it likely that other factors do not have a systematic effect in one group relative to the other, which effectively controls the other factors. In medicine, such studies are common and they are called randomized controlled trials. In schools, however, randomized controlled trials are generally not feasible. If a pre- and post-test are used without an experimental design, the only factor really controlled is the time interval between the tests. This time interval is critical as a number of other factors are affected by the passage of time. For this reason, generally it is not feasible to interpret an effect size without considering the amount of time between pre- and post-tests. Now, having said this, using a pre- and post-test provides a valuable indication of how well a group of students has progressed. This process becomes more useful in a school setting if data are collected on multiple occasions. Doing so gives a sense of the baseline level of progress for a given teacher or a given cohort. This can provide some indication of whether strategies or programs have had an impact. Still, however, some care needs to be taken in using pre- and post-tests. I'll discuss this next. I'll talk about 3 possible ways of proceeding, with a focus on the advantages and disadvantages of each. The first method is to use the same test before and after the period. For example, we might use a mathematics test in February as a pre-test, and exactly the same test in November as a post-test. A theoretical advantage of this method is that because exactly the same test is used, the pre-test average in February can be compared directly with the post-test average in November. However, the disadvantage of this method is that it is prone to teaching to the specific test. It is very difficult in practice to avoid this disadvantage. There are also practice effects involved. For these reasons, using the same test as a pre-test and a post-test is normally not an ideal option. Using different tests as the pre- and post-tests may help to avoid teaching literally to a single test. However, it is difficult to construct 2 tests intended to measure the same thing so that the tests have exactly the same difficulty. 2 tests can be said to have the same difficulty if a single group of students obtains a very similar average score on the 2 tests. Even for professional test designers, it is very difficult to construct tests with exactly the same difficulty. Now, differences between test difficulties directly affect the interpretation of effect sizes. For example, if the post-test is more difficult than the pre-test, the average score of a group of students may be the same after a period of time such as a year of schooling, giving a 0 effect size. Obviously though, this result wouldn't really indicate a lack of progress, as the second test is more difficult. The basic trouble with using different tests is that there is no way of knowing whether the change of test scores is due to progress by students or a difference between the difficulties of the tests. Differences between test difficulties can easily alter the effect size by 0.2 or more in either direction. Probably the best method for obtaining effect sizes is to use separate tests such as 2 NAPLAN tests that have a common scale. For example, a NAPLAN scale score from a Year 3 test in one calendar year can be directly compared with a NAPLAN scale score from a Year 3 test in another calendar year. A method called test equating is used to make scores on separate tests comparable. If 2 different tests are used as the pre- and post-test, the effects of teaching to a single test are mitigated somewhat. There are various other considerations in using effect size. The spread of scores may be smaller or larger in one group relative to another. For example, the spread of scores for Year 3 students may be larger in one school than in another school. If the spread of scores is larger in one school than another, the denominator in the effect size calculation is larger. So for example, if there is the same progress in School A as School B, but School B has a higher spread, students in School B will have a smaller calculated effect size. Obviously, this is misleading. There is a margin of uncertainty associated with any effect size that is calculated. With a smaller sample, there is less certainty about the real effect size. There's no absolute cutoff for how small a sample can be. However, to give a sense, with a sample size of about 25, the margin of uncertainty around an effect size may be as high as 0.2. This means that if the real effect size is 0.4, we could only expect the effect size calculated from scores to be in a range between 0.2 and 0.6 with about 68% likelihood. Some of the time, we'd expect the effect size calculated to be even further away from 0.4 in one direction or the other. An individual score on each test also has a margin of uncertainty associated with it. At the individual level, there is no mean, and it doesn't make sense to refer to an effect size given the history of the use of this term. There is simply a standardized difference, or a z-score for a difference. The margin of uncertainty for an individual on a typical assessment amounts to an effect size of around 0.4. A further consideration is that evidence from large-scale programs indicates that progress over time tends to differ for different age groups. In many learning areas, the amount of progress per year is larger for younger students and smaller for older students. For example, in NAPLAN and other Australian programs, there is generally larger growth from Year 3 to 5 than there is from Year 7 to 9. Obtaining pre- and post-test results is a useful practice in itself. Doing so provides an indication of progress throughout a period of time and can be very useful for monitoring performance and evaluating programs and strategies. The main motivation for using effect sizes is to report changes in average scores in a way that may be comparable across different contexts, such as schools or classrooms within a school. Also, to a certain degree, effect sizes may sometimes be interpreted in the context of background research, so there is a frame of reference for interpreting the effect sizes. However, we need to be circumspect when we interpret effect sizes. Care needs to be taken in choosing the method by which effect sizes are obtained. Care also needs to be taken in the interpretation of effect sizes. Some of the key factors to consider are as follows. The time between pre- and post-test is a critical factor. Effect size will usually increase over time due to a range of factors. Strictly, effect sizes can't be attributed to specific causes or factors unless all factors but the ones we're interested in have been controlled. Informed guesses about causes is reasonable provided they are recognized as being informed guesses. Using the same pre- and post-test is not a good option because of teaching to the single test. Using different tests pre and post that have no common scale is generally not a good idea, as the tests are unlikely to be equally difficult. Using different tests or tasks with the same scale is optimal. Where there is a greater spread of scores, the effect size will tend to be smaller, other things being equal. The margin of uncertainty is increasingly important with smaller numbers of students. Used judiciously, effect sizes can be a useful tool. On the other hand, when effect sizes are used or interpreted carelessly, they may actually lead to ill-informed decision-making.